So Lisa, how do you see our talk informing our peers and colleagues as outpatients or hematology providers?
Yeah, that's a really good question. For our talks, we really focusing, using patient case to walk through the workflow to really help emphasize on APP practice. For my talk, because I was covering the early relapse, and since we have so many treatment options we talked earlier, and especially when patient at the early stage relapse and there's multiple treatment options. So in my part of the talk, I show a workflow on a patient real case and demonstrate how APPs can apply NCCN guidelines and choose recommended regimens, then consider all the factors related to the patient, their disease, and treatment to narrow down the treatment options. So this is very important. I hope this step-by-step shared decision-making workflow really benefit the APPs in their daily real-life practice to help individualize patients develop the best treatment options for them.
So Lisa, what would you like participants to take away from our session today?
Yeah, for the early relapse, every time we suspect patients has progression with relapse disease, and doing a restaging is very important. So that's really help us to determine the needs and timing to start a new line of therapy. For those patients who has biochemical relapse, slow progression, no high-risk features, the guidelines saying we may not require immediate therapy change and close monitoring is appropriate. And when we are choosing the next line of therapy, we talk about we have to consider every factor is correlated to the patient's preference and their disease and also treatment history. And more importantly, we talk about clinical trials needs to be considered at every stage of therapy. So now with moving CAR T therapy into earlier relapse, the decision who should go on for CAR T at early relapse needs to be in consultation with CAR T specialists. So Miriam, do you want to comment more about what do you think about most information you want to deliver to our learners about bispecific and CAR T?
That's a great question, Lisa. I do agree that with so many treatment options available, there's no longer a standard practice in a way. There might be for newly diagnosed therapy, but as the patient progresses in second, third, fourth line therapy, the decisions really need to be tailored based on the patient-specific factors, their treatment history, their comorbidities. I do feel that a referral to a CAR T specialist early on is appropriate, just to talk about the risks and benefits of early versus delayed treatment. Bispecifics are also, those tend to be used later on in the disease course. And those have their own unique toxicities along with CAR T that really require expertise and a solid foundation with the literature. So again, referral to a CAR T center or a myeloma specialty group to help navigate those complex treatment decisions really goes a long way.
That is an excellent point. Early referral is really important. It's help to establish a correlationship between academic center and community oncology. Also, early referral to academic center, maybe there's like a CAR T trial or new bispecific clinical trials that patient may be eligible for. So I want to add it on because Jet Pro Life offers on-demand period to watch recorded session. So if any attendees were unable to watch our in-person presentation, then you should have opportunities to watch our recorded session at a later time. Thank you.
Thanks for joining us for Jet Pro 2025.